Today we're diving deep into a topic that affects millions of people worldwide but often doesn't get the attention it deserves until it's too late. We're talking about colon cancer, also known as colorectal cancer. This is going to be a comprehensive guide covering everything you need to know: what colon cancer is, who's at risk, the warning signs to watch for, how it's diagnosed and treated, and most importantly, how you can protect yourself and your loved ones. I know this might seem like a heavy topic, but knowledge is power when it comes to your health. By the end of this video, you'll have all the tools you need to make informed decisions about colon cancer screening and prevention. Before we jump in, I want to remind you that this video is for educational purposes only and should never replace professional medical advice. Always consult with your healthcare provider about your individual situation. Let's get started. What is colon cancer? So, what exactly is colon cancer? Simply put, colon cancer occurs when cells in the large intestine, or colon, begin to grow uncontrollably. The colon is the final part of your digestive system. It's about 5 feet long and includes both the colon and rectum, which is why you'll often hear it's called colorectal cancer. Here's how it typically develops. Most colon cancers start as small, benign clumps of cells called polyps. Think of polyps as little mushroom-like growths on the inner wall of your colon. Not all polyps become cancerous, but some types, particularly adenomatous polyps, can turn into cancer over time if they're not removed. This transformation doesn't happen overnight. It usually takes about 10 to 15 years for a polyp to develop into cancer. This is actually good news because it gives us a huge window of opportunity for prevention and early detection. There are different types of colon cancer, but about 95% are adenocarcinomas, which develop from the cells that line the inside of the colon and rectum. Other less common types include carcinoid tumours, lymphomas and sarcomas, but we'll focus mainly on adenocarcinomas today, since they're by far the most common. Statistics and impact. Let's talk numbers for a moment, because they really put this disease into perspective. Colon cancer is the third most common cancer diagnosed in both men and women in the United States, excluding skin cancers. Each year, about 150,000 new cases are diagnosed, and unfortunately, about 53,000 people die from the disease annually. But here's the encouraging part. When caught early, colon cancer is highly treatable. The 5-year survival rate for localized colon cancer is about 90%. Even when the cancer has spread to nearby lymph nodes, the survival rate is still around 71%. This underscores just how important early detection really is. The average age of diagnosis is around 68 for men and 72 for women. But don't let that fool you into thinking younger people are immune. We're actually seeing an alarming increase in colon cancer rates among people under 50, which is why screening guidelines have recently been updated. Risk factors. Now let's discuss who's most at risk for developing colon cancer. Understanding your risk factors is crucial because it helps you and your doctor determine the best screening strategy for you. First, let's talk about factors you can't control. Age is the biggest risk factor. Your risk increases significantly after age 45 and continues to rise as you get older. About 9 out of 10 people diagnosed with colon cancer are over 45. Family history plays a major role. If you have a first-degree relative, that's a parent, sibling or child, who's had colon cancer, your risk is 2 to 3 times higher than average. If multiple family members have been affected, or if someone was diagnosed before age 45, your risk is even higher. Certain inherited genetic conditions dramatically increase risk. Lynch syndrome, also called hereditary non-polyposis colorectal cancer, accounts for about 3–5% of all colon cancer. Familial adenomatous polyposis, or FAP, causes hundreds to thousands of polyps to develop in the colon, almost guaranteeing cancer if left untreated. Having inflammatory bowel disease Either Crohn's disease or ulcerative colitis increases your risk, especially if you've had it for many years. Now for the factors you can control, and this is where it gets really empowering. Diet plays a huge role. Diets high in red meat, particularly processed meats like bacon, sausage and deli meats, increase risk. The World Health Organization has classified processed meat as a Group 1 carcinogen. On the flip side, diets rich in fruits, vegetables and whole grains appear to be protective. Physical activity is incredibly important. People who are regularly active have a 20-30% lower risk of developing colon cancer compared to those who are sedentary. Colon cancer significantly increases colon cancer risk too. Smokers are 30-40% more likely to die from colon cancer than non-smokers. Heavy alcohol consumption, particularly beer and spirits, increases risk. The more you drink, the higher your risk. Obesity, especially abdominal obesity, increases risk by about 50% in men and 20% in women. So I'm talking and warning, signs have something really important to understand. Early stage colon cancer often has no symptoms at all. This is exactly why regular screening is so crucial. We need to catch it before symptoms develop. However, as colon cancer progresses, it can cause various symptoms. I want to emphasize that these symptoms can also be caused by many other, much more common conditions, so don't panic if you experience them. But they should prompt you to see your doctor for evaluation. The most common symptoms include changes in bowel habits that last more than a few days. This could mean diarrhea, constipation, or a change in stool consistency. Pay attention to stools that are consistently narrower than usual, sometimes called pencil stools. Blood in the stool is another warning sign. This might be bright red blood or very dark, tarry stools. Sometimes the blood isn't visible to the naked eye, which is why stool tests for hidden blood are part of screening per defence. And this could be cramps, gas, bloating or pain that doesn't go away, a feeling that your bowel doesn't empty completely after a bowel movement. Unexplained weight loss, especially if it's significant or happens quickly. Weakness or fatigue that can't be explained by other factors. Iron deficiency anemia, particularly in men or postmenopausal women, can be a sign of slow bleeding from a colon tumour. Now, I want to stress again, these symptoms are much more commonly caused by other conditions like hemorrhoids, infections, inflammatory bowel disease, or even just dietary changes. But if you have any of these symptoms, especially if they persist for more than a few weeks, it's important to see your healthcare provider. Screening methods. This brings us to one of the most important parts of our discussion, screening. Colon cancer screening is one of the most powerful tools we have in medicine for preventing cancer deaths, and yet it's significantly underutilised. Colon's guidelines from major medical organisations recommend that people at average risk begin screening at age 45. This was recently lowered from age 50 due to the increasing rates of colon cancer in younger adults. If you're at higher risk due to family history or other factors, you may need to start screening earlier. Let's go through the main screening options. Colonoscopy is considered the gold standard. During this procedure, a flexible tube with a camera is inserted through the rectum to examine the entire colon. The doctor can see the colon walls directly and remove any polyps they find during the same procedure. It's typically done every 10 years if results are normal. Yes, the preparation isn't fun. You have to drink a solution that clears out your colon. But the procedure itself is usually done under sedation, so most people don't remember it at all. Flexible sigmoidoscopy examines only the lower part of the colon. It's done every 5 years and doesn't require full sedation, but it can miss cancers in the upper part of the colon. Collapse colonography, also called virtual colonoscopy, uses CT scans to create detailed images of the colon. It's less invasive than traditional colonoscopy, but still requires bowel preparation, and if polyps are found, you'll need a regular colonoscopy to remove them. For those who prefer non-invasive options, there are several stool-based tests. The the fecal immunochemical test looks for hidden blood in stool and is done annually. It's more accurate than older stool blood tests and doesn't require dietary restrictions. Stool DNA tests like Cologuard look for both blood and DNA changes associated with colon cancer. They're done every 3 years but are more expensive and have higher false positive rates. Multi-tagnate stool RNA tests are newer options that look for genetic markers of cancer. The best screening test is the one you'll actually do. If you're nervous about colonoscopy, starting with a stool test is better than not screening at all. However, it's important to understand that colonoscopy is the only test that can both detect and remove polyps in a single procedure. Diagnosis process. If screening tests suggest possible colon cancer, or if you have symptoms that concern your doctor, you'll likely need additional testing for a definition diagnosis. The diagnostic process typically starts with a thorough medical history and physical exam. Your doctor will ask about your symptoms, family history, and other risk factors. A colonoscopy will be performed if it hasn't been done already. During this procedure, if suspicious areas are found, the doctor will take small tissue samples called biopsies. These samples are sent to a pathologist who examines them under a microscope to determine if cancer cells are present. If cancer is diagnosed, additional tests are needed to determine the stage, that is, how far the cancer has spread. This process is called staging, and it's crucial for determining the best treatment approach. Staging tests might include CT scans of the chest, abdomen and pelvis to look for spread to other organs. Blood tests measure levels of substances like CEA, carcinoembryonic antigen, which can be elevated in colon cancer. Sometimes MRI or PET scans are used for more detailed imaging. The staging system for colon cancer goes from stage 0 to stage 5. Stage 0 means abnormal cells are present but haven't spread. This isn't truly cancer yet. Stage 1 means the cancer is confined to the colon wall. Stage 2 means it has grown through the colon wall but hasn't reached lymph nodes. Stage 3 indicates spread to nearby lymph nodes. Stage 4 means the cancer has spread to distant organs like the liver or lungs. Treatment options. Treatment for colon cancer has improved dramatically over the past few decades, with many new options available. The specific treatment plan depends on several factors: the stage of the cancer, its location, your overall health, and your personal preferences. Surgery is the main treatment for colon cancer that hasn't spread to distant organs. For early stage cancers, sometimes polyps can be removed during colonoscopy itself. For larger tumours, part of the colon needs to be surgically removed, along with nearby lymph nodes. This is called a colectomy. Thanks to advances in surgical techniques, including minimally invasive, laparoscopic and robotic surgery, recovery times have shortened and complications have decreased. In most cases, the remaining parts of the colon can be reconnected, so normal bowel function is preserved. For rectal cancers, surgery is more complex because of the rectum's location in the pelvis, near other important structures. Sometimes radiation and chemotherapy are given before surgery to shrink the tumour. Chemotherapy uses drugs to kill cancer cells. It might be given after surgery to eliminate any remaining cancer cells. This is called adjuvant chemotherapy. For advanced colon cancer, chemotherapy can help control the disease and relieve symptoms. Modern chemotherapy regimens are much more effective and have fewer side effects than older treatments. Common drugs include 5-fluorouracil, oxaliplatin, and irinotecan, often used in combination. Targeted therapy represents a major advance in colon cancer treatment. These drugs target specific features of cancer cells. For example, bevacizumab targets blood vessel growth, while cetuximab and panitumumab target a protein called EGFR. These drugs are typically used for advanced cancer immunotherapy, is an exciting newer treatment that helps the immune system fight cancer. Drugs like pembrolizumab and nivolumab have shown remarkable results in colon cancers with certain genetic features, particularly those with microsatellite instability. Radiation therapy uses high-energy beams to kill cancer cells. It's more commonly used for rectal cancer than colon cancer, often combined with chemotherapy. Treatment decisions should always involve a multidisciplinary team, including surgeons, medical oncologists, radiation oncologists, and other specialists. Many cancer centres have tumour boards where specialists review cases together to recommend the best treatment approach. It's also important to discuss clinical trials with your doctor. These studies test new treatments and often provide access to cutting-edge therapies before they're widely available. Prevention strategies. Now let's talk about prevention. This is where you have the most power to protect yourself and your family. Screening is prevention. I can't emphasize this enough. Regular screening prevents colon cancer. It also catches cancer early, when it's most treatable. If you're 45 or older, talk to your doctor about screening options. Dietary modifications can significantly reduce your risk. Increase fibre intake through fruits, vegetables and whole grains. Aim for at least 25-30 grams of fibre daily. Fibre helps move waste through the colon more quickly and may bind to cancer-causing substances. Basically, drink more weed. Reduce red meat consumption, especially processed meats. Then under-eat over. Try to limit red meat to no more than 18 ounces per week and minimise processed meats like bacon, sausage and deli meats. Include calcium and vitamin D in your diet through dairy products, leafy greens and supplements if needed. Consider foods rich in folate like leafy greens, beans and fortified cereals. Physical activity is incredibly protective. Aim for at least 150 minutes of moderate intensity exercise weekly or 75 minutes of vigorous activity. This could be as simple as brisk walking, swimming or cycling. Maintain a healthy weight. Obesity, especially abdominal obesity, significantly increases colon cancer risk. Even modest weight loss can be beneficial. Don't smoke, and if you do smoke, quit. Smoking increases both the risk of developing colon cancer and dying from it. Limit alcohol consumption. If you drink, do so in moderation. No more than 1 drink daily for women, 2 for men. Consider aspirin therapy, but only after discussing with your doctor. Some studies suggest regular low-dose aspirin might reduce colon cancer risk. Living with colon cancer. For those diagnosed with colon cancer, it's important to know that survivorship has improved dramatically. Many people go on to live full, active lives after treatment. Follow-up care is crucial and typically includes regular checkups, blood tests and imaging studies to monitor for recurrence. Your healthcare team will create a personalised surveillance plan. Emotional support is just as important as medical treatment. Consider joining support groups, either in person or online, where you can connect with others who understand what you're going through. Many cancer centres offer counselling services and support programs. Lifestyle factors remain important after treatment. Continuing to eat a healthy diet, stay physically active and avoid smoking can improve outcomes and reduce the risk of recurrence. Don't hesitate to ask questions and advocate for yourself throughout your treatment journey. You are the most important member of your healthcare team. Conclusion. We've covered a lot of ground today, from understanding what colon cancer is to learning about prevention and treatment options. The key takeaways I want you to remember are: colon cancer is largely preventable through screening and lifestyle modifications. If you're 45 or older, don't delay, Talk to your doctor about screening options. If you have risk factors, you might need to start even earlier. Pay attention to your body and don't ignore persistent symptoms, but remember that these symptoms usually have benign causes. The treatments for colon cancer have improved dramatically, with many people living long, healthy lives after diagnosis. You have more control over your colon cancer risk than you might think through diet, exercise, and other lifestyle choices. Knowledge is power, but action is what saves lives. Use the information from today's video to take charge of your health. If this video was helpful, please give it a thumbs up and subscribe for more health content. Share it with family and friends. You never know whose life you might save by spreading awareness about colon cancer screening.